Hi, I'm Dr. Heather Franzerty Stratton.
And hi, I'm Dr. Blakesley.
And we're at HPS Advanced Dental Care, located in Shelby Township, Michigan. We can be reached at 248-652-0024. Today we wanted to talk about a few questions that we get from patients or people that are calling the office, or just in general. Last night I was on the baseball field with my son, and I had somebody come up to me and ask this question yesterday. So we just wanted to touch base on some of those questions that we get asked a lot. And when you need to call the dentist, and when it's okay to kind of do some home care and see if it passes on its own. The first thing I wanted to talk about was a lot of questions that we get asked is about my tooth just broke or my filling came out. What should I do? If your tooth broke or your filling came out, chances are you're either going to need a new filling or potentially a crown or a cap put on your tooth. Assuming you're not a dentist sitting at your own home, you're probably going to need some professional dental care. You'll need to call your dental office and have it evaluated. Oftentimes people, think, oh my gosh, now I need a root canal or something more extensive is going to need to be done. Oftentimes, like the gentleman I saw on the baseball field last night, it looked like he just needed a new filling put in his tooth. So usually it's an easy fix, and if you get in, relatively soon, that way there's not bacteria and whatnot, decay getting inside the tooth. Sometimes when the filling comes out, we wait a long period of time. The tooth does get worse over time, and it does need more extensive work done. So if you can get in within the next couple of weeks, once that tooth breaks or the filling comes out, it's usually for the best. But if you have any questions about that, give our office a call.
Great. Another question that we've heard a lot, patients will call and say, I have a little pimple or a little blister on the side of my gums, and they're concerned as to why is it there? Should I pop it? What should I do? Should I take medicine? So what we always recommend patients, if they notice anything in their oral cavity, whether it's a sore or something red or something like a little pimple, to call our office to let us know, because it's usually a sign that the tooth might be dying, the nerve might be dying, or maybe it's just a little irritation that they might have poked themselves, and it's just a very simple fix. But we always want to take a look so we can make sure we guide them in the right direction and help them. A lot of times a young child will notice that as well, or the mom will notice on their child, and that can be a sign too that the nerve, there might be a little cavity in the tooth that's gotten into the nerve, and we can take care of that and fix that and protect the tooth so that when their permanent tooth is ready to come in, the baby tooth will be healthy and won't have to come out before it's supposed to. So if you notice anything like that in your mouth, or a little pimple or a little blister, please feel free to call the office at 248-652-0024, and we can help you with that.